Good morning. Welcome to today's webinar, Spotlight on McCloud, Everything You Need to Know. My name is Rachel Pine, and I look after content for the PLSA's events and training. This is just our second webinar since returning from the summer holidays, and it's great to be back. We hope that you were able to take some holiday time as well. Over the past few months, when we ask our LGPS and other public sector fund members about what is important to them, McCloud comes up far and away as the area of most concern. It's number one by a mile. And the excellent attendance for today's webinar proves that point. There are so many of you here today. That's why we're especially pleased to have Equiniti as our education partner, as they are really going to get under the bonnet of McCloud for us and show us how we got here, what it means for members, steps that you can take now to begin to solve McCloud, and ideas about communicating what's going to happen with your members. We're very pleased to welcome Andrew Lowe of Equiniti, who is their Change and Data Solutions Director, and Paul Harris, who is a Program Manager at MyCSP. Both Andrew and Paul have many years of experience in public sector pensions, and they each understand the unique complexities and challenge of these schemes. Not only that, they have the courage and perseverance necessary to take on McCloud. It's like the Ironman triathlon of pensions administration. Just a little bit about Equiniti. They are one of the UK's largest providers of outsourced pensions administration, supporting around 9 million scheme members, and last year delivered £25 billion in payments to 3.5 million pension and annuity recipients. So they've got quite a lot of scale. And so I think now we're ready to hear from our first speaker, Andrew Lowe. Welcome, Andrew.
Thanks, Rachel, and thanks for that wonderfully generous introduction. Yeah, really looking forward to this session and the opportunity to talk about McCloud in a group of people who are inevitably going to be facing some very, very difficult and similar challenges to that which myself and Paul are, as you say, tackling head on for some of our schemes and clients that we're already working with. So opportunity to sort of share some information, bit of best practice, knowledge, etc., and hopefully that'll help everyone tackle what is inevitably going to be a very, very difficult problem. So yes, as you say, Rachel, my name's Andrew Lowe. I'm the Change and Data Solutions Director for Equiniti Paymaster, and we are looking at trying to solve the McCloud problem for a number of clients already, and really trying to make sure that we can share best practice with other providers and lots of other schemes. So this is, as I say, a great opportunity to do that. In terms of what we're going to cover today, really brief high-level agenda, bearing in mind that we want to leave plenty of time for questions. We don't want to dwell too much on some of this, and I know a lot of people from their responses prior to the event have got a decent grounding and an understanding of the McCloud situation already. So we'll do a little bit of where are we and how did we get here. We'll have a look at a couple of member examples just to highlight the importance of some of the areas that will be particularly the calculation and the communication areas that will be essential to make sure that the McCloud delivery, that any McCloud delivery is really focusing on members and getting the right messages out to them. And then I'm going to hand over to Paul, who's going to take a look at what program structure might look like, depending on whether you're local government scheme, wider public sector, which stakeholders and professional services providers you might be operating with, and how your program could be structured, and particularly then focusing on what we can start now, because I think it's essential, bearing in mind what the sheer volume and complexity of the work that we've got to cover. It's essential that we all get started on solving this problem as quickly as possible, notwithstanding obviously the results of the consultations that are ongoing and have been over the summertime. So if we move on to next slide, I'm hoping that there won't be too much of a delay in making that happen. Yep, here we go. What's the problem? So just a little bit of the background on implementation of public sector pensions reforms in 2014 and 2015, transitional protections were provided to some members to smooth the introduction of the new schemes. Amongst other things, this was based on members' age and has given rise to unlawful age discrimination, and the impact of that has been seen right across the public sector pension scheme landscape. So lots of interesting challenges that's going to give us. Going into a little bit more detail of how we got here, obviously this all stems from going back 10 years plus now, the Hutton report and discussion of what suitable new schemes for public sector pensions would look like. As we mentioned, the implementation of them came with some transitional protections to sort of ease those implementations, ensure that there was no cliff edge for members, particularly those closer to retirement, but that those transitional protections were ultimately to some extent based on age, and so therefore have led to this age discrimination. Very quickly after the introduction of these schemes in 2014, 2015, there were some challenges across most of the main public sector schemes very quickly. McCloud is the name that stuck, which obviously is the challenge to the judiciary scheme. Sargent was very closely aligned to that, and that's the firefighters one, but each individual public sector scheme has had its own challenges, and those individual cases are moving forward, you know, as we speak, and have been over the last sort of 12 or 18 months since the read across decision was made by government, by Treasury last year. So obviously, you know, moving into the legal arena, the Court of Appeal ruled that these protections were discriminatory in 2018. The government were considering appeal to Supreme Court last year, but they were denied the opportunity to even make that appeal. And as I say, post that, it was accepted that this decision had consequences right across the public sector, not just in the McCloud and Sargent cases. So all members who were impacted in all public sector schemes would need to have their benefits addressed and perhaps some form of remediation applied. There are employment tribunals ongoing for the impacted cases, and that they will inevitably have to settle in the appropriate way. And I think there will potentially be some consideration of non-pensions remediation as part of that too. Whether or not that goes anywhere, I'm not an expert. I'm not going to comment on that. We'll just leave that subject to one side and focus on the pensions aspects of the McCloud implementation now. Obviously, we've got consultations which were launched in July, which are ongoing, separate ones for different schemes. Responses early next month, and we'll see what comes as a result of that, which will ultimately shape the remediation that needs to take place for members and the detailed scope of the programme of delivery for each of our individual schemes. There are some other areas and consequential impacts where we've got items that are being impacted by McCloud. Cost cap is certainly one, which flares up in terms of noise from time to time. Be that from GAD's view on how cost cap should be implemented, whether or not it can be done before McCloud, post McCloud, whether it's challenges from members or unions, etc. So there are lots of other issues in the sort of regulatory and scheme environment that we need to consider alongside McCloud. But ultimately, as Rachel suggested, McCloud is the big ticket thing that I think a lot of these things will hang off, and if we don't have answers to and a solution and a timeline for a solution to McCloud, then we will inevitably hit trouble in trying to solve the other elements as well. So before we move on to just talk a little bit about the consultations movement, and then after that we'll move on to the first of our poll questions. But yeah, as I said, consultations launched mid-July, different responses and solutions for different schemes. LGPS, with the underpin that existed as part of the as part of the transitional protections for the change in 2014 there, has potentially some different opportunities and options to solve the McCloud problem than perhaps the wider public sector do. The specifics of the judiciary scheme have meant that they need a separate consultation as well. And I think some of the elements that have influenced the need for these separate consultations and separate discussions, we just listed a few of them before in terms of what prior schemes looked like, whether or not, as I say, there's an underpin like there is in the LGPS, which doesn't exist in some of the other wider public sector schemes. Retirement ages mean that there are very different considerations in different areas. Survivors' benefits are a key one, particularly in cases where proportions of members' benefits have changed between the pre-Hutton and the post-Hutton reform schemes that can make a significant difference to not just the choice, if members have a choice that the members would make, but ultimately, whether or not that choice would be the same depending on your individual scenarios and individual circumstances. I think pension features and the events that people have been through in their own careers can have a similar impact as well. Measurement of pensionable service, etc. So there's a lot of different reasons and different considerations as to why the different schemes will respond. We'll have to respond individually to make sure that we get the right response to the consultation overall. So our first poll question, if we can do that before we move on to some discussion of the impact on members, is going to be around how well do you feel your scheme is equipped to deal with solving the McCloud problem. So I'll give everybody a good 30 seconds or so to answer that, and we'll see where we get to, because I think that might shape where we go with the detail of some of the remainder of the presentation.
Thanks, everyone. So the choices are very well. We have confidence in some areas. It's going to be a challenge, or you're not sure.
And I think that option 3 is potentially a little euphemistic, if I'm being honest.
Right. So I'm going to end this poll. It looks like everyone has voted. And
Excellent.
as you can see, this going to be a challenge. Euphemistic is the clear winner. No one said it's going very well. 21% we have confidence in some areas, and 6% are not sure.
Yeah, and as I say, I mean, I think that it's going to be a challenge. That makes sense. I didn't want to preempt that answer, but I think that's where we all are at the moment. Particularly, as I say, we haven't got a full understanding of what that scope looks like. Post consultation, that will bring a few more things into focus, and bring people's confidence levels either up or down. So yeah, no, that's interesting, and we'll come back on to a couple more questions later on. Thanks, Rachel. Which might drive out a little more, put a little more flesh on the bones of that answer. So yeah, that's really helpful to understand. And I think, Paul, feel free to add to this when you come in, but I think that's kind of where we feel we are with the clients we're working with as well. There are definitely areas where we feel like we know where we're going. There are other areas where the challenge is daily, and it's evolving daily. So yeah, lots to do. Okay, so we're moving on to what it means for members, and got a couple of examples here. So let me just make sure. Here we go. Yeah, we've got a simple example from LGPS here, as I know a lot of today's attendees are representing LGPS schemes. So we're going to look at an individual here who's 50 years old as at 1st of April 2022. Obviously, the proposed remedy date. We're working on the basis of a 2008 scheme NRA of 65, 2014 scheme NRA of 67. Salary of £30,000 a year at 1st of April 2014, inflation of 2.5%, full-time service for the full remedy period of 8 years. if we just look at their remedy pension, and let's ignore their benefits which would have pre-existed that in the 2008 scheme, and anything that would be accrued post-remedy, then based on those assumptions, depending on the retirement age at 62, 65 and 67, 62 obviously being early for both schemes, 65 being normal retirement for 2008, 67 being normal retirement for 2014, we can see a little bit of a difference in favour of the 2008 scheme being the benefit. So in other words, an underpin that would bite for that individual member. And you can see that the level to which it bites is, it's nearly £600 at 62, it's about £700 at 65, and it drops off a little bit to about £450 at 67. Now that's based on the member having 1% real salary growth from 2014 all the way up to retirement, which 65 would obviously be 2037 in this instance, with them being 50 in 2022. However, and I think this is an interesting one, because I've heard lots of people, particularly members, when we've done dip samples with certain clients and gone out to employers, etc. We've heard members say, well, this just means I'm going to be put back in my old scheme and benefit from it. What about a scenario where we've got no real salary growth? And I think this is definitely something that we've seen over the last decade or so is public sector employees where real salary growth has been a challenge. Without promotions, without anything like that, salaries pegged roughly to inflation has been not uncommon. So if we look at these numbers, without the real salary growth, we find very quickly that actually, in some instances significantly, the real benefit lies in the 2014 scheme. So actually, in the LGPS, the underpin wouldn't bite. In the other schemes, if the member were to have a choice, the choice may well be, and in some cases, particularly when we get to age 67, the choice is quite stark. That we may well be looking at a benefit of £300 at 62 in the 2014 scheme, about £700 at 65, increasing to as much as nearly £1,100 in the 2014 scheme. The further down the road we get, so it isn't clear, depending on the individual member's circumstances, which scheme will benefit them. And I think that's really it's really important that we can communicate the fact to members effectively that it's not a cut and dried case where you're going to be going one way or you're going to be going the other way into one scheme or the other. In other words, or in the case of LGPS, benefiting necessarily from the underpin. So I'm going to take that opportunity to ask another poll question, if we can, Rachel, and this time it is around what you think your members are expecting the impact on their benefits to be. We've only got the three options this time. So are they expecting a significant improvement by essentially getting prior schemes better benefits, which, as I say, is a noise that we've heard significantly? Is there some expectation of improved benefits but no clear view? Or do you think that overall that members are not engaged with how the change will be at this time? And again, I don't want to preempt the answer, but it'll be interesting to see if there's a uniform response to this one as well.
You can see.
Right. Wow. Okay. Interesting.
Trend here.
Okay. There definitely is. Yeah. Okay. Well, that's really interesting. And again, that probably says we've got a lot of work to do around our communications and making sure that we get them right. However, glass half full, looking at it that way, it gives us the opportunity to land the message appropriately with members. And I think that message is really important, which is what I'm going to try to illustrate in the next slide. So simple scenarios can be exceptionally confusing. So we've looked at no real salary growth and we've looked at 1% real salary growth, and it was clear based on different retirement ages which scheme would win. However, if we go for 0.5% real salary growth, which is somewhere in the middle, and again, not an unusual type scenario, we can see that at 62 in this LGPS example, 2008 scheme's the winner. But at 65 and 67, the 2014 scheme is the winner. And obviously there's going to be a crossover point somewhere between 62 and 65, which will be exceptionally confusing for the member. Now, that is still a very straightforward example of uniform salary growth. If we throw in non-uniform salary growth for promotions, job changes, part-time hours fluctuations, all of those types of scenarios, which are absolutely 10 a penny right across all of our schemes, and then we think about other differences in benefit structure, such as ill health benefits, death benefits, and in the wider public sector, the potential for choosing the option, not just being allocated the one that's better for you, then you can see how not just for pensions, not just for members, but for us as pensions professionals, it's a pretty mind-blowing scenario. And it really brings us into the thought that the generic communications material and then the member-specific communications material has to be absolutely spot on to help members understand what their particular scenario is and how it's going to impact them, whether that's because they've a choice to make or even just for the purposes of retirement planning, because that difference of a few hundred or £1,000 a year for a member with a £30,000 salary is the difference between whether they can retire at one age or the next, or it's the difference between their lifestyle in retirement. And actually giving them that information and enabling them to own the retirement saving is really what the best outcome or what a good outcome from McCloud will look like. So I'm going to hand over to Paul now. He's going to walk through a little bit of how we go about solving this problem.
Okay, thank you, Andrew. So, good morning, everybody. My name is Paul Harris. I'm a program manager within MyCSP. MyCSP is the administrator for the Civil Service Pension Scheme, and we're part of the wider Equiniti group. My role within MyCSP is to be the program manager for the McCloud, we call it 2015 Remedy. So you might hear me mention that during today's presentation. But to be, so I manage the scope of work that we're performing on behalf of the Civil Service Pension Scheme. So I'm very focused on the sorts of civil service pension arrangements, but obviously a lot of this applies and there's read across to different schemes as well. I'm going to talk to you basically about two things today. So one around, what will it take to solve and the sort of program structure that you can put in place and, tailor to fit your particular circumstances. And then also, some activities that can certainly be undertaken now, even despite the unknowns and the uncertainties that exist and the consultation ongoing. There's a lot that can be done now and that we're undertaking that we'd like to share with you and just really get a feel for whether that's something that is, where you are on the journey of that as well, and whether that's any help to you. So really just starting with this slide here, this is what we term the jigsaw lid. It's meant to be the picture on the top of the box that really describes what the scope of the program is for, certainly for our scheme that we're involved in. And you'll see there's different colored boxes, and it's really around being able to present the scope of the program in something that's actually really quite visual, that people that aren't within the weeds of the program can understand. So it has real benefits in being able to articulate to various stakeholders what the program is all about, and it shows where there's sort of certain chunks of work. So it delineates areas of program scope into sensible and more manageable chunks, and that's really sort of the benefit one of doing something like this. The other benefit is around, for people that you've got involved in the program, especially when you're talking about there's probably multiple suppliers that are involved in delivering certain aspects of scope of the program. Having something that's actually really quite simplistic is quite powerful in being able to say, well, look, you're responsible for that box over there, and someone else is responsible for another. And the third value of something like this is that it allows a traceability that exists as you progress through the program. So certainly where we're using it in the civil service pension scheme is we were able to take down the sort of, and this is essentially a product breakdown structure for those of you that, you know, are sort of in the sort of project space. But it's been able to take the areas of scope, be able to define which projects are going to deliver those areas of scope. And then once you start working through each of those projects and be able to define, well, okay, what are they, you know, what's their objectives? How much effort is it going to take to deliver them? What's the cost of delivering them? Then you can start to essentially color in the jigsaw. You get a view of how much, say, you know, the program, you know, managing the program is going to cost. You get a view of how much effort is going to be able to deliver the data aspects in order to, you know, administer the solution. So you can, again, it's really helpful from a, you know, bringing the program together into something quite simple to say, well, look, this is the impact of the program, and it helps really control the scope of the program. And, you know, I mean, we could probably talk for an hour just on how best to chunk it up. You know, we've coloured in and we know what those certain boxes are, you know, the 2.1s, etc. on this diagram. You know, this is something you can take away and have a think about yourselves. There are some aspects there, the program, that obviously sits right across, you know, the whole program and the whole scope. And same with the comms and engagement, it's essentially a wrapper. And the bits in the middle are very much around, you know, individual scope items that, you know, are contained within that wrapper. I did think I would just touch on the prioritised cohorts bit there, as, you know, which is a really interesting thing that we're seeing within the civil service scheme, and I suspect is happening elsewhere too, in that there's a desire to administer the remedy for certain groups of people prior, you know, to basically put them as sort of front of the queue. And it means that really we need a thin slice of the solution to be ready earlier than when we're delivering the main bit of the solution. And that obviously presents, you know, multiple challenges to the likes of myself and program teams, you know, up and down the country, is to say, well, you know, how can we deliver something in a consistent way, and also without, you know, the rules and the policy being confirmed at this point in time. So that's why those are there, and it sort of cuts across the other areas as well. Okay. So I think we were going to just take a question there, really around trying to get a sense check for where do you feel yourselves are in terms of the journey of having a McCloud program of work set up.
Right. So the question is, have you already established a McCloud program of work and involved your key suppliers? Yes, we're already running an effective program. We have a framework in place, but are not fully operational. We are waiting on the consultation response, or not yet. And as you can see, Paul, half of them are waiting on the consultation response, 7% already running an effective program, so good for them. 18% we have a framework in place, but not fully operational. And another quarter, 25%, not yet.
Yeah. I think that's really interesting. There's a bit more of a spread there, isn't there? I mean, I think, you know, if I was trying to answer this for where I think, you know, myself and the team we've got, the civil service pension scheme, I'd probably say we're somewhere between the top two answers, you know, in that, you know, I think we've done some key items around, you know, setting up, you know, the governance and the lie of the land in order to get the program operational. But there's still some significant challenges that we're facing in terms of really being able to stand up, you know, and you know, things like, you know, just the resource and being able to stand up people to support and develop and to get motoring. So we're certainly not operating at, you know, sort of full speed yet, but we're certainly getting there. But it's really interesting, and thank you all for your responses on that. So I think, bearing in mind then those responses, it probably fits quite nicely, because we can talk now about what can be done now. And I think, Andrew, if you can just click through, there's 5 hexagons here. So I think there's 5 main areas. There's the member insight, you know, and we'll go through each of these in a bit more detail. So I'll quickly run through these. There's member insight, data, comms and engagement, solution approach, and then, you know, establishing the program, which we've just touched on there, but I will sort of top and tail it at the end as well. So I think there's certainly lots to do, you know, and there's lots that can be done, lots of productive work that can be done now, even before final remedy is agreed. I mean, I know we're not too far from the consultation being complete, but there's still probably a bit of time before that to really, the dust to settle on the consultation. So I think, in this interim, there's certainly some things that, some people might be able to take away from this session and look at doing as, going forward. So if we start with member insight, which is on the next slide. So there's just a few, aspects here, and really insight is essential really for us to be able to shape the solution, the needs of the solution, and the priorities as well. So some aspects of it, who. So, if you use the civil service scheme as an example, we now have a list of which members are impacted by the scheme, and so we've done a member analysis, and it's, we've got 414,000 members that we know are in scope of remedy. And we know, certain things about them. So we know, what scheme membership they've had. We know their age. We know their sort of which salary banding they fit into, who they work for. We've got a lot of employers that, will be part of the program and will be part of the solution, delivering messages and supporting members. Engagement, actually, that's probably one that we're probably a little bit weaker on, around understanding, the levels of engagement with the pension. But we do know their service details. We know what pension events are taking place and what features they have. So do they have any, additional complexities that are going to cause us a problem when we come to, administer and deliver a remedy solution? So, the sorts of, unusual cases that might be much more complicated to do an automated solution for. And what we're doing with the insight is one, it's useful in itself. It's useful for program teams to understand and know the members. It's useful for stakeholders to get that view as well, so everyone's on the same page. But we're also using it to build personas in a view to get, and essentially, apply the 80-20 rule. If we can understand, the broad membership and get a view of what they are and who they are and what concerns they have, then we can really put the members in at the heart of the solution and really focus on what it will feel like for them. So we'll be developing personas and then pushing them through member journeys, and this allows us to test whether a particular solution might work for one particular group of people, but it might not work for another. It really allows us to test how it's going to sort of land with members. And in addition, we'll be talking and getting to comms engagement about how we sort of test that, in a bit more real with, actual real people. But there's certainly a lot that can be done in the insight, and a lot of the data is there and is available, and you probably have, available to you, and it's a way of, what really needs to happen is to bring it together into something that is, it's not just data, but it is insight. It gives some powerful intelligence that you can use to inform the other areas of the program. So I think if we move on to the next one, I think we've got data next. So yeah, we all know that we're going to need data to calculate the benefits on the old and new schemes. The good thing here is we already know what the data required is going to be. So it's quite easy for us to do an assessment there to say, well, okay, we know what's required. Have we got it? Is the data complete? Now that's probably quite a binary answer. It's quite an easy one. Probably the more complexity, or the greater complexity, is the data clean enough for you to do something with? And by something, I mean really around using automated tools. Certainly with the volume we're talking about, and probably similar for the vast majority of schemes out there. Everyone will want some form of bulk solution. But in order for a bulk solution to work, we've got to have confidence that the data that's going in is going to actually, is correct. It's the old adage that, rubbish in, rubbish out. So, and I think, certainly from our experience, from sort of service scheme and across other schemes is, no one has got perfect data, but it's about understanding, well, where do those challenges exist? And what can you then do to potentially, mitigate them, or, clean some of the data, fill some of the gaps. And where that's not possible, or where it's just basically going to be, just too difficult to do, too time consuming to do, how do you work around that? So, really, key message here, data is obviously an enabler to administering the remedy and delivering the remedy, but it's also a key dependency, and it's one that is quite a long, it's quite a long dependency, particularly where there's, you're dependent on other people providing data to you. So we are dependent on employers being able to provide data to us, being able to engage with them, for them to engage with their shared service, payroll providers, etc. takes time. Okay, so that's one that I would definitely, advocate, looking into and getting the ball rolling on. Okay, if we move on to comms and engagement. So yeah, being able to understand and then obviously meet the member preferences and needs over what's going to be a really extended period, requires significant planning, a lot of engagement from various parties, and it will require some innovation. There'll be differences in how we deliver this solution to what may have been delivered in the past, I suspect. And to the left there, there's some various things to think about. What channel are the messages going to be delivered on? So obviously, ideally, everyone wants to be doing digital, but how what is the digital capability that you've got within your scheme? If it's fairly low, is that going to work for members? Or is there another program of activity to drive up channel shift? Sorry, Andrew, you've just skipped on. There you go. Thank you. What coverage? And this is again 80-20 rule. So quite often, and I touched on this before. Around the priority cohorts. We're certainly looking at some some relatively small groups of people and trying to address their needs first. Now, it almost feels a bit counterintuitive, because normally you probably look at it and say, well, let's look at the majority first and understand what their needs, and then we will look at some of the more exception cases separately. But in this instance, that's not going to be entirely possible. So you really need to think around what's the coverage and what messages are going to be delivered to what people. Market testing, how are you going to test these messages? Can you get focus groups? Can you do webinars with members, in order to sense check where they're feeling? What stakeholders are going to need to engage to support messages? Because you probably can't do it all by yourself, and there needs to be some, a broader set of messages that that support the member through the journey. Timing, what is the plan for engagement, and what is the plan for communication? When's the warm-up going to start? And it's obviously really difficult, especially when there's a bit of uncertainty around, well, okay, when's the remedy period end date going to finish, as an example? And then finally, what supporting tools do you need? This being able, and Andrew went through a great example before. Now, being able to articulate that in something that was a piece of paper or a PDF document that's emailed is probably not going to cut it, because it's just not going to give the flexibility to say, well, to personalize it for each individual member's circumstances. But then counter that, so that means that you're talking a modeling capability, but then in order to model with any sort of precision and variability for members, then you've got to think, well, actually, we're going to make this thing too complicated, and it just becomes unusable for the average member. So there's real things to think about there around the sort of comms engagement. Again, getting started is key. And it's always the hardest step. Thinking, well, okay, I'm going to start writing the comms and engagement strategy here. That's the hard step. But once you start it kind of gets easier. Okay, I think if we go into the next one, please. Solution approach. So this is really around, and there's quite a bit on this page, but it's really around what's the overall architecture that you think is going to support you in delivering the remedy. What what are the pieces that you've got that are currently there, you know, the systems and the tools that you've currently got available, and what can you leverage to deliver the McCloud remedy? And also what isn't there, you know, especially, you know, what do you need to develop, and how's that going to fit into your current architecture? How are you going to do that whilst protecting, you know, the normal business as usual that isn't just, you know, is not going to stop as this program continues? You know, there's some of the challenges we're certainly grappling with at the minute. We've got the timing for different priorities, as I've mentioned previously. You know, there's that balance of automation and complexity. You know, and really, I think, you know, the sort of message here was definitely around, you know, understanding current capability. And I think I put it there at the bottom, and understanding the landscape as well. You know, being clear and honest about, well, okay, these are our strengths, and, you know, let's build on those. Here are our capabilities that we've got. But where there are challenges, then, you know, there's a sense of, well, okay, we need some support here. And also, you know, there's a healthy dose of realism doesn't hurt in this space. You know, there's this is going to be complex enough. You know, you certainly don't want to sort of completely overhaul your current, you know, business as usual system and put business as usual at risk in order to deliver remedy. Yeah. And there's some other things in there. You know, use the data. You know, use the member analysis that, you know, hopefully, you know, that you'll be working on as well, and use your understanding of the data that we've talked about, you know, just before to influence your decision making, because, you know, it's useful not just for it itself, and not just because it then, you know, you understand who it, you know, who's impacted, but it is useful for then informing, you know, sort of development activity and development costs as well. So, you know, use it, I would suggest. And then finally, around sort of bringing together suppliers under the one program. I've said before, it's unlikely that, you know, it's one group, you know, one particular organisation that's going to deliver this. They need to work together. They need to be, you know, working in harmony. The last thing that I think anyone wants within a program is, you know, any sorts of client supplier type challenges that exist. They just get in the way. We've all been there before, and, you know, understanding that, you know, and being open and honest with each other is definitely the order of the day in order to get a successful program. And I think, I'll just leave you with the, you know, there's obviously individuality here. You know, there's differences between different schemes and different organisations within the same scheme, but there's definitely a commonality, you know, within the approach and you know, things that can be done to tackle the problem. Okay. I think I did have I think I had a poll question here as well before we got into this slide, and it was about the timing. Rachel, are you able to put that one up, please?
Yep, there it is. Do you believe that 2022 is a realistic implementation date for a full McCloud remedy, including remedial work, future solutions, and effective member communications? And as you can see, there is a clear bias toward no. 84% feel that it's 2022 is not realistic. 16% feel that it is.
Thank goodness. There's real challenges, you know, with 2022, not least the fact that by the time we start to, you know, the dust settles on the consultations, you know, we're talking circa 15 months before, you know, that remedy period end date, you know, of 2022. And, you know, given the scale of program that we're talking about, you know, and the amount of people impacted by it, you know, that presents a real challenge. You know, I think you know, there's obviously a lot that to be decided across government here. You know, in terms of, well, even if they stuck with 2022, well, okay, what's the expectation around when actual rectification activity will start? You know, does it have to be, you know, the day after? Probably not. You know, so there's certain decisions that are going to need to form after the consultation outcome. I think what I would suggest, and you know, we have within the scheme a a plan on a page, which is got more lines on it than this, but it matches to the jigsaw lid. So we've got each of the different areas. We've got our projects, and we've got a rough understanding of how much those projects are going to take to deliver. So almost we've just kind of put them on to a timeline to say, well, okay, irrespective of what's going on in the consultation, based on a number of assumptions, how long do we think this would take? Rough guess, estimate. And again, that's a really powerful thing just to do and to have. It will change, and it will probably change quite drastically, but it's a really useful exercise in doing it. And it's something that, again, I would probably recommend that those that, are probably certainly at the early stages of looking at the program, it's one of those things that is useful as, to do, put near the top of the priority list, certainly. Okay, I think I've probably come to the end of certainly my bit, and I know we did want to leave, some time for questions. So I'll probably just hand back to Rachel, and then to just invite questions from people, please.
Yeah, so please put your questions in the Q&A box. I've received one that's really quite a good question we can start off with while other people are thinking about their questions. And I'm not sure if this is for Paul or Andrew, but you can just jump in. How do you balance the need for remediation and communication with protecting business as usual activity for people? They're still retiring, leaving, transferring. It's all business as usual. How does that go?
Well, I'll take it first, Paul. I mean, I think that's it's a really important thing that we get right. And as Paul talked about with his timeline there's a lot of activities that need to go on. The business as usual activities will inevitably change over time as a result of the implementation of whatever the consultation outcome is. I think the way in which we're trying to manage that most effectively is protect the business as usual administration delivery as much as we can by utilizing that skill set where we need it, but delivering as much of the McCloud remedy through a program team as we can, and that program team will look to support both the future admin solution as well as any remedial activity, for individual members. So I think it's a very difficult balance to get right, because you don't want to ignore the skills that exist in your ongoing delivery team, but you don't want to dilute them to the point where you can't deliver it. So it's a definite challenge, and I think it's one where good planning and understanding of, as Paul says, your data, your individual members, and where your difficulties will arise is essential.
Very good. Another good question that's just come in. What are your thoughts on the pros and cons of immediate choice versus deferred choice underpin, and which would be easier or better for scheme administrators?
Immediate versus deferred choice. I think that the natural reaction of most people is that deferred choice for wider public sector will be better for the member, because there'll be more information available for them to make a decision at the point which they have to choose. I'm not 100% in that camp, if I'm honest. I think that, having the point of decision being deferred, be that by an underpin or a deferred choice mechanism, means it makes it very difficult for the member to plan for their retirement effectively. I think also what it does is it brings in, even beyond the point of making the decision, there are still things that will occur in the member's lifetime, even if it's just ultimately the end of their life and ultimately death and dependence benefits being paid and all the rest of it, where the difference between a pre-2014-15 scheme and a post-2014-15 scheme might be essential to understand. So there'll still be modelling to do at member level, regardless whether it's a now choice or a future choice. So if I couple the fact that the individual planning will be tough, along with the fact that, going to deferred choice instead of immediate choice is turning a 3 or 4 year problem into a 40-year problem, from a cost of administration, a cost of change, a future complexity for this for schemes to handle, I think the decision is much closer than some commentators and some people I've spoken to think, where the suggestion is that deferred choice is the only way to go from a member perspective. That said, I do see the benefits of deferred choice in some cases, and perhaps on an 80-20 basis for members, deferred choice will be the slightly better one for them. So I'll be interested to see the balance of consultation responses on the immediate versus deferred choice issue.
Yeah, very good. Thanks for that. What about members who have complex scenarios like transfers, added pensions, and other scenarios that come up? How will the remedy deal with those people?
I'll give you a break if you want, Andrew. So I think there's, TBC. So I think there's, there's a lot in the various consultations that, so there's a lot of, potential different ways that the outcomes may go. I think the important thing is that there are, it's the recognition that there are complex scenarios that's important, for schemes to get a grip of, and it's again it's part of that member insight, knowing which members are impacted and what situations do they have, do they have added pensions, transferings, etc., divorces, any additional other benefits that might have been available, etc., that and certainly what we're facing and what we've got an understanding of, there's some things that are available within the reform schemes that aren't available in the older schemes. So what do you do with the members that got them? How do you convert them into something that does exist in the older scheme, if that's the one that they want to go? How do you compare apples and pears in this scenario? And that's so I think the answer is we don't really know how it's going to play out, but what we do understand is actually communicating that to members and being able to allow them to make an informed choice is where the challenge lies. And I think it links to the previous question. It's especially if it's an immediate choice aspect, then being able to present all the facts and figures and everything they need to make that informed decision is a challenge.
All right, very good. We've got time for one more question. Jumping well ahead, will Equiniti have a specially allocated team to produce the benefit statements as a comparison for different schemes so that members can make the right decision for themselves?
Yeah, I mean that's a great question. The issue underpinning it is a great question. I think, Paul, you alluded to it in your comms and engagement slide, where you were talking about is a benefit statement going to be enough for members to make the right decision for themselves? Because ultimately you need to consider future scenarios. Whether that is, you're going to have two people who are otherwise exactly the same, but one feels that there's a likelihood of, that they're in less good health, so ill health retirement might mean more of an influence on them. One who's got, extensive family and children, one who doesn't have dependents. What are the impacts of one decision or one scheme versus the other for them, and how are they different? And it's very hard to put that on a single piece of paper. So I think our view at the moment is, obviously benefit statements are something that are going to need to carry on. And there are, disclosure regulations of what has to go in benefit statement. And if I think beyond what benefit statements might look like today and into the future, or something else that I'm very passionate about in terms of, say, pensions dashboard, how do we display member benefits in a way that is meaningful to members, I think is really the crux of what we're talking about here. And I think what we've got to do through the initial McCloud communications is get members used to the concept of the fact that they may have option A or option B at some point in the future, whether that's through an underpin or a deferred choice. That can then be clearly articulated through something like a benefit statement, and supported by some of those other perhaps digital modeling tools, whatever it might look like, to help members understand where that will take them to at retirement. In terms of having a specially allocated team for that, I think depending on your scheme, your situation, and the decisions that you want to make around how you want to communicate with members, I would say at this point, there are no options that are off the table. I think we will have to find a way to deliver quality benefit statements, because that's a disclosure requirement, as I said. But it's where you go from there and what you use the information on the benefit statements to do that really is at the heart of that. And that may well be something that it differs on the basis of what different scheme managers and different groups of members are actually needing, if that makes sense.
Very good. Well, thanks for that. That's all we have time for today. Thank you, all of you who joined today, Andrew, Paul, and their Equiniti colleagues, and my colleagues at the PLSA who put this together. Thanks for joining, and we hope to see you very soon. Bye-bye.